Okay, so welcome back to the second video in which we're discussing angina pectoris, specifically exertional angina pectoris. Right, so we're in the process of discussing the usual response of the heart to exercise. Okay, so basically we have discussed that when you start exercising, your skeletal muscle is going to be respiring more because it needs to produce more ATP in order to fuel the contraction. Okay, right. That means that it's going to require a greater delivery of nutrients, i.e. a greater perfusion. Now, if you're going to deliver a greater perfusion to the skeletal muscle, what's going to have to happen is you're going to have to increase the amount of blood that is moving through the heart in a minute, basically. So it's common sense. If more blood has to be delivered to the tissues, to the peripheral tissues, then more blood is going to have to move from the venous side to the arterial side through the heart, basically. So cardiac output, which is the amount of blood moving through the heart in a minute, is going to have to go up. Now, how can we increase the amount of blood that the heart moves from the venous side to the arterial side in a minute? Well, two ways. We can either increase the force with which the heart contracts. By doing that, you're going to ensure that the heart is going to squeeze more blood, a greater amount of the blood that's in it, out into the aorta, basically. So that could increase the cardiac output. In addition, we can increase the rate at which the heart's beating, and we can do this by decreasing the amount of time which the heart is in diastole. Okay, so if that was the normal heartbeat there, what we can do is we can decrease the time in which it's in diastole. So we could do something like this, maybe. Then what we'd have is we'd have the heart beating more times in a given amount of time, and every time the heart beats, it ejects a certain volume of blood. So if you increase the number of times it beats in a certain amount of time, then you're going to increase the total amount of blood that you eject from the heart in that period of time. Okay, so let me colour these in. So orange is each beat of the heart, and then the clear bit is the time we spend in between each beat of the heart, so the diastole, or the relaxation of the period for the heart. Okay, so overall now, what's happened is you're spending more time in systole, and you have increased the number of times the heart beats in this given amount of time, and that means that you're going to have ejected more blood. So those are the responses of the heart to this increased demand for perfusion, basically. Okay, now there's a problem in all of this, and this is that basically if the heart's going to beat more times in a given amount of time, and also it's going to beat more forcibly on each of these, then it's going to use more nutrients itself. Now, so the heart is using more nutrients, so the demand on oxygen and glucose, but specifically oxygen, has gone up. So the oxygen demand has gone up, basically. Okay, now, here's the other problem. The heart has lots of blood vessels in it that are supplying the myocardium, okay? But if you think about this, these blood vessels, the little blood vessels coming off of these large coronary arteries, are going to sort of go through the myocardium. Now, every time the myocardium contracts, so these are in the wall of the heart, every time the myocardium contracts, it's going to force those blood vessels shut because they are within the wall of this myocardium, so they're going to get squashed in between it. So let me draw another picture for this. So if this is the wall of the heart, so I've taken a cross-section of the wall of the heart, then here, let's say this is the blood vessel in the middle there, basically. And then, when the myocardium around it, which I'll denote in purple here, contracts, what's going to happen is that you're going to squash that blood vessel shut. So, here's your blood vessel now squashed shut, basically. Okay, so, when the heart is contracting, it can't get any blood, basically. No blood is being delivered to the heart whilst it's actually in systole, which is the fancy name for it's contracting. So whilst the heart is in systole, it's not receiving any blood. So the only time it receives blood is when it's in diastole. So this is systole when it's contracted, and this is diastole where it's relaxed. So only in these bits in between each heartbeat is the heart actually receiving blood itself. So if we now look at how much time you spend in diastole in this new heartbeat, which is faster, you have much less time to deliver nutrients to the heart, because the diastolic periods are much shorter. That's what we did to increase the heart rate. We had to shorten the diastolic periods. So the time for which the heart is in diastole is shorter. So the amount of time you have to deliver nutrients to the myocardium is reduced. So basically your nutrient delivery, your oxygen delivery, has gone down. So the heart is burning more fuel and is requiring more oxygen, but the amount of fuel and the amount of oxygen you're giving it has reduced. Okay, this is a crisis, basically. How are we going to solve this problem? Well, the answer in a healthy person is to dilate this blood vessel. Okay, so what you will do is basically you'll make the blood vessel much larger, so that the amount of blood coming through it when it's open is going to be greater. So why is this a solution? Well, the diastolic period is now shorter, so the time in which you're feeding the heart, for, is shorter. So what's the solution to that? Well, if you widen the artery, if you dilate the artery, then the amount of blood that's going to be flowing through this when it's open, i.e. when you're in the diastolic period, is going to be greater. So for this shorter period, you are now going to be delivering more nutrients in a certain amount of time. So basically your solution is to dilate the blood vessels so that even though the time period for which you feed the heart is shorter, you deliver the same amount of nutrients, basically. In fact, you need to deliver more now, because the heart not only has oxygen delivery gone down, but its demand has gone up because it's having to contract more forcibly now. Okay, so you dilate the blood vessels so that even though the time for which you feed the heart has gone down, the actual rapidity, the amount you feed the heart in a certain amount of time is now gone up. So the amount you feed the heart in a certain amount of time, the rate at which you feed the heart has gone up because you've dilated the blood vessel, which means more nutrients is coming in whilst the blood vessel is actually open. So that's the solution, basically, to get around this problem that the diastolic period, or the heart's feeding time, has gone down. It's just that whilst the feeding time is there, you're making better use of it, effectively. You're delivering more food in a certain amount of time now. Okay, right. So that's how, in the usual heart, you cope with exercise, basically. Now, let's say we have some sort of problem. Let's say we have some sort of atherosclerotic plaque, maybe, in one of our coronary arteries. And I should stress that it's not just these blood vessels that are going to dilate. The whole coronary arteries are going to have to dilate as well. So if you're going to get more blood coming through these ones, you need the coronary arteries to dilate as well, because they're the ones which supply these ones. Okay, so the coronary arteries are going to dilate, and that's going to allow you to deliver more blood to the heart whilst it's in these diastolic periods. Okay, so what happens if we've got a massive, great atherosclerotic plaque in our coronary artery? So let's say we have a massive, great atherosclerotic plaque here. Okay, so this represents an let me just bring it down here, an atherosclerotic plaque. Atherosclerotic plaque. Right, okay, now atherosclerotic plaques are going to reduce the lumen of the coronary artery. Okay, so even when you're at rest, the blood flow is going to be impaired. So what's going to happen is that gradually over time these coronary arteries are going to dilate and dilate and dilate as much as they can to try and return the blood flow through this coronary artery to normal, i.e. the coronary artery will try its best to compensate for the fact that it's got this great big plaque obstructing blood flow. So basically it will dilate. So let's show it here. So it will gradually dilate, okay? Now, it will reach a point where it has reached its utter maximum dilatation, i.e. it cannot dilate anymore. No matter what it does, it will not dilate anymore, okay? Now, if you're in this situation, you've had this atherosclerotic plaque, and gradually over time your coronary artery has widened to try and deal with that problem, then what's going to happen if you try and exercise? Well, you're going to have the same flow chart as before. So your skeletal muscle is going to be burning more ATP, so the perfusion that the skeletal muscle requires is going to go up. So you're going to deliver more blood to the skeletal muscle. Okay, that means that the cardiac output is going to have to go up. Okay, and in order to raise cardiac output, the heartbeat's going to go up, and also the force of contraction is going to go up. Now, the same problem which occurs in the healthy person is now going to occur in this person, which is that you're spending less time in diastole and more time in systole in a given amount of time. Now, diastole is the only time where you can actually feed the heart, basically. So, if we're spending less time in diastole, we're going to feed the heart less. The amount of nutrients we're actually going to deliver to the heart muscle is less. Couple this to the fact that the actual nutrient demand is greater because we're having to contract more often, and also we're contracting harder. The inotropy has gone up. Okay, so the solution again would be to dilate the blood vessels, and in that shorter period where you are actually feeding the heart, to make better use of that time and deliver nutrients more quickly in that period, basically. The problem is, this coronary artery cannot dilate, so it can't increase the perfusion of the heart muscle. So you're stuffed, basically. Okay, so what happens is that metabolites quickly build up in the myocardium. So let's say this portion of the myocardium isn't receiving a great enough perfusion, okay? So wasteful metabolites, the waste that the myocardium is producing, those metabolic waste products are going to build up. So metabolic waste products build up. Also, you're going to start getting hypoxia. Metabolic waste products go up. Now, what this is going to cause is it will, if this happens for long enough, it will lead to myocardial infarction of this portion of the myocardium. I.e., this portion of the myocardium is not receiving enough oxygen and its waste products are building up, and if that continues for too long, it will start to infarct and you'll suffer a heart attack or a myocardial infarction. However, before that happens, what will occur is angina pectoris. You will get horrendous crushing chest pain because this portion of the myocardium is requiring more oxygen than it's actually being delivered, basically. So that's why you get this crushing chest pain. It's the warning, basically. The myocardium is sending the brain a warning. It's saying, you have to stop this exercise. We can't cope. You're going to tip us into myocardial infarction if you're not careful. And you feel this crushing chest pain, basically, which often radiates to refers to the left shoulder as well, but not always. And that is the pathophysiology of angina pectoris, at least exertional angina pectoris.